Let's talk about the respiratory system, specifically the inner or superficial lining of the respiratory system that we call the respiratory epithelium. Respiratory epithelium is describing just the overall way that we can protect the system. There's 4 types of tissue in the body: epithelial, connective, muscle, and nervous. When we looked at epithelial tissue early on in the course, we talked about the different types based on its shape and its function. And we looked at the number of layers and then its overall appearance, which is its shape, because the structure gives us its function. And one of the things we talked about was pseudostratified, ciliated, columnar epithelium. Pseudo, false, that it appears stratified, 2+ layers, but it's actually just 1 layer connected to that basement membrane. And then it's ciliated, meaning we have these little extensions coming off the cell surface. And if we remember, we have microvilli for absorption, but we have cilia to move something across the cell surface. For the respiratory system, we're actually using cilia to trap with mucus, so I can spit something out and swallow it or get rid of it based on what I'm breathing in. So we're trapping some of the things that we are exposed to in the external environment, typically like dust and particles. And then columnar, referring to the more like finger cells or columns. It gives us that space. So when we have columns, more room in the cytoplasm, more functional organelles to give us a structural piece to it, which typically is going to indicate that we're creating mucus. So let's talk about respiratory epithelium. When I pull this away, and it's lined through different parts that we'll discuss later, when we get into the deeper part of the respiratory portion of the zones for inhalation and exhalation, it's going to change, and we won't see this PSCC, but primarily when we go through our pharynx, and then when we see this in the trachea, it's lined what we call our respiratory epithelium, and it's pseudostratified ciliated columnar epithelium, mixed in with what we call goblet cells, or they're called mucus cells because they produce mucus. Mucus is produced in different organs throughout the body, but in this case, we use mucus to trap particles, and we create what like a mucus escalator. So as I breathe in junk, I can spit it out or swallow it so it doesn't impact the way I breathe, so it doesn't infect my lungs. We see this impacting our body when we're sick. When we have a common cold, this builds up. We have extra mucus because our body's trying to fight something off. So what we're describing is when we pull this, the inner lining, not the outside, the superficial inner lining of, say, the trachea, and we look inside just this lining here, from here up, this is my pseudostratified ciliated columnar epithelium. So this is lined with epithelial tissue. Down here, you start to see some of that tracheal cartilage, which is hyaline cartilage, which is a whole different topic. But it gives us that structural support. We're talking about the inner lining as the air is coming through here, and I breathe in or out. What it's lined with, all these little hairs here, are cilia. So on the top of the epithelial tissue, I have cilia to help line on top of here. And what's happening is I have mucus cells built in within the tissue. So as I come over here and look at this in an expanded view, as a higher magnification, I can still see the cilia running across. And again, the cilia is designed to move something across the cell surface. So within all the pseudostratified ciliated columnar epithelium, I have mucus cells breathing in, and I'm continuously secreting the mucus. It'll come up to the top. And when I say top, superficial, so as I breathe in and out, say I breathe in a lot of dust, or say you got exposed to a lot of smoke, or some people that do actually smoke, they tend to cough more. Our body's trying to fight off what's been put into the lungs, and we can end up with diseases starting with destroying this lining. So as I look at the cilia, I can force it out, but my body's gradually doing it. I just don't know it all the time. Where I do notice it is when I'm sick. So when we talk about the respiratory epithelium, we're talking about pseudostratified ciliated columnar epithelium, which are active cells that create protection physically, but they're actively creating a product, mucus in this case, to support that, almost that glue to trap what we breathe in so we can spit it out and swallow it, which is an amazing piece to just the start of the respiratory system, because we're trying to make sure the lungs function as best as possible. Because if we can't breathe, especially over 3 minutes, we start to have damage to the rest of our body, primarily to our central nervous system. So this is respiratory epithelium.